Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, and I'm joined today by the beautiful, amazing Emily Cahill. Emily is a registered nurse. She works in a large cardiovascular hospital here in Melbourne. She's also a fully qualified naturopath. She's also the only kidney disease solution trained practitioner in the world that's trained with Duncan and myself. And she is a writer of most of our blogs and our Facebook posts. And if you've ever sent in a request or a comment to our email support team, she's one of our 2 naturopaths that will be answering and supporting you with anything that you need to go through the protocol. Emily, welcome.
Thank you. Thanks for having me again.
Again, yeah. Wow. It's got such a good brain on you, and since you're writing so many of our articles, you are just, it's obvious. So we thought today we would talk about antibiotics and why potentially they can be an issue with people with kidney disease. So why don't we just dive straight on in? I think everybody knows what antibiotics are, but why don't you give us a bit of an overview and go from there?
Yeah. So antibiotics, which are obviously very necessary in certain circumstances, so can also be potentially harmful to the body. And one of the organs that they can be potentially harmful to is the kidneys. So, certain antibiotics are classed as what are called nephrotoxic drugs. So nephro being kidneys, toxic being toxic, so potentially being toxic to the kidneys. So that's something that doctors obviously need to be aware of, that people need to be aware of, that when they're taking antibiotics, the potential for having kidney damage. Now, in saying that, people who already have kidney disease are at higher risk of developing what's called acute kidney impairment, or AKI, which is what happens with certain nephrotoxic medications like antibiotics. So they're definitely sort of in, I guess, a class of people who need to be more aware of it. All medications have the potential to be damaging to the body, but we know that certain antibiotics are more likely, or I guess have more potential to be damaging to the kidneys.
So let's go through those. What are those antibiotics that people, you've got kidney disease, and maybe you just go to your local GP because you've got a bit of an infection, and maybe that GP isn't your regular one, and they don't know. What do you need to know as a kidney patient to make sure that you're flagging and making sure that you're not taking?
Yeah. So I guess the classes of antibiotics that are most well known for causing nephrotoxicity are the aminoglycosides. So things like the mycin type drugs, gentamicin, tobramycin, neomycin.
Yeah. Then
also there's a class called beta-lactams, which includes our penicillin type drugs as well. So that's quite a commonly prescribed antibiotics. But also things like cefalexin and our cephalosporins as well. Then, one of the, I guess, really well-known medications is vancomycin. And then there's also some antiviral drugs or antifungal drugs like amphotericin B, acyclovir, which is given for viral infections as well, that are kind of the better known nephrotoxic drugs.
Keep going.
No, I was just going to say your point there about if you are needing antibiotics, really important that you if it's not obviously your doctor, but that your doctor is aware that you have kidney disease before they prescribe anything, because obviously, what we would prefer is to avoid those nephrotoxic drugs in people with kidney disease. It's not always possible, but definitely if it can be done, that's sort of the first thing to point out.
Yeah, and so you use the word nephrotoxic. So let's go through the mechanism of how antibiotics cause kidney damage and why they, you know, even for people that maybe don't have kidney disease. I've had patients have damaged kidneys from antibiotic use. So go through and just talk about how antibiotics have that effect and why they have that nephrotoxic effect on the kidneys.
Yeah. So I guess the kidneys being the filtering units of the body are more commonly, say, affected than some other organs, because when you're taking antibiotics, the byproducts and part of the drugs needs to be filtered through your kidneys for you to be able to excrete it. So they're kind of right at that point of being in contact with, I guess, these drugs. There's various different ways that they can cause this acute kidney impairment or cause kidney damage. So some of them cause interstitial nephritis, which is when you get inflammation and swelling within the kidneys, in the nephrons. Some of them can cause necrosis, so actual necrosis or death to parts of the kidney tubules. And that's largely because they can cause high amounts of oxidative stress or oxidative damage within the kidneys. Some of them can end up some antibiotics aren't completely soluble in urine. So we end up with these crystals being formed. And if the crystals actually deposit within the tubules in the kidney, that can cause damage in itself. We can get inflammation of the glomeruli, so glomerulonephritis. And the other thing that some medications, including antibiotics, can do is cause something that's called Fanconi syndrome. And that's when there's damage to the proximal tubule of the kidney. And what happens is that people start to excrete massive amounts of things like glucose or bicarb or phosphates or uric acid, amino acids into their urine. A lot of these things are all molecules that shouldn't go through the filtering units because they're too large. So in that excretion, we then end up with damage.
Yeah. Great. So we've covered which drugs. What symptoms are people looking out for if they've had some antibiotics and they're worried that maybe there's been some kidney function changes? So I guess that's symptoms of kidney disease, which can be so ranging. But what would people with kidney disease also be looking out for if they're worried that they've taken an antibiotic that you've mentioned now and they're like, my doctor didn't flag me? What do I need to do? How would I know? All of those sort of things. Yeah.
So symptoms and like you said, sort of symptoms of kidney disease. So things like fatigue, swelling, if suddenly you're getting new swelling in your ankles or feet or hands or around your face, changes in, how often you're needing to urinate, things like seeing bubbles in your urine, so a bit of a sign that maybe there's some protein loss, pain, so pain around sort of the flank area. Mm-hmm. And then the other, I guess, important thing would be if you are someone with kidney disease particularly and you're on what's known to be a nephrotoxic medication, that your kidney function is being measured whilst you're on that medication as well. So that way, any decline in kidney function can get picked up as soon as possible.
Yeah, I think that's the really most important thing. And I think even with non-nephrotoxic antibiotics, if you're on a new medication short term, you should check your kidney function right after you finish, just to, because as you mentioned, the kidneys are the filtering system, right? And so everything's going to go through there. So just checking in to make sure that whatever you're taking hasn't had a negative effect on your kidney function. I think it's always a smart thing to do. And if you've got a good doctor, they should always be more than happy to do that for you. Mm-hmm. So if someone has had a slight decline in kidney function after an antibiotic, what are some things that people could do to maybe bump their function back up? Is there something that's quite antibiotic specifically related that would be really useful for kidney function?
Yeah, so probably one of the best known, I guess, supplements will be N-acetylcysteine. So that has probably got the most evidence for protecting the kidneys against lots of things, but including medications or antibiotics. So damage from those things, or things like contrast as well.
Yes.
So that's probably been studied the most. And then, looking at other antioxidant type treatments, like alpha lipoic acid, also anti-inflammatories. So if the medication particularly has caused inflammation within the kidneys, then we're wanting to help to reduce that. So things like fish oil can be really good in that sort of instance. Anything that I guess is really, protective and has the potential to reduce the damage that has been caused. So anti-inflammatory, antioxidant type nutrients would be the ones that kind of really jump to mind there.
And, lots of people like to use probiotics and things like that after antibiotics, and why that's not quite specific per se, maybe to the kidney. That's a gut thing. There are probiotics that are very kidney specific. Is it after you've taken I'm always putting on my my patients on probiotics after they've been on an antibiotic, but is there any ones that you would think are more specific for kidneys, or you would think, they've got some kidney function issues, so maybe I'll prescribe a different type of probiotic in this case, or are you just going to use your normal ones?
I would probably just use my usual probiotics, sort of the ones that we know are particularly good after antibiotic use. Yeah. Definitely, like in the interim, whether using probiotics is something that you want to use to help, with your kidney function and also your gut sort of in the longer term. But I just mean more so looking at replenishing the gut and protecting the gut after the antibiotics.
Yeah, I think that's a good thing. What else do we need? Anything else you want to add about antibiotics?
I guess probably just the things to think about or be aware of if you do need to go on to antibiotics. Well, for one, actually, probably even before that step, is only use them when they are necessary. So there's a whole another topic, but antibiotics can be frequently prescribed when they're A, not necessary, and B, actually not going to be having any effect. So, for example, for viruses, for colds and flus, I think that there was a study by the CDC that showed that something like 1 million, 100 million antibiotic scripts that were written every year actually unnecessary in the US. So that's the first thing to be aware of. And then the second thing is discussing with your doctor, obviously letting them know you've got kidney disease, and just ensuring that you're using the most kidney-friendly, I guess, antibiotic that they're able to use with you. And then also particularly being aware if you are on any other medications that have the potential, or that are nephrotoxic or have the potential to be nephrotoxic. So things like the non-steroidal anti-inflammatories or diuretics, or some of your blood pressure medication like your ACE inhibitors, having that sort of discussion with your doctor is if whether you should be either reducing the dose or stopping any medications just over that period of being on antibiotics, because that just lessens the potential for damage.
Yeah. And
then as well, making sure that you're drinking enough. The faster the more we can dilute these drugs, and the quicker we can excrete them out of the body, the less potential they have to cause damage as well.
Yeah, I totally agree. And what Emily's referencing there with the other medications is something called a triple whammy, which is a non-steroidal ACE type inhibitor drugs, and then your antibiotics, and they're known as what we call a triple whammy. So when you take all three at the same time, there's quite a elevated risk of kidney damage, and basically anyone that has kidney disease should avoid a triple whammy. And what's scary, and Emily spoke about and I spoke about this in another podcast, is not a huge percentage. There are definitely a percentage of chronic kidney disease patients that are prescribed triple whammy and it's not been checked or monitored because maybe a doctor, as we mentioned, has prescribed an antibiotic for a skin condition long term and they don't know there's kidney disease and they're already on a non-steroidal and something like an angiotensin inhibitor or something like that. So definitely always discuss your medications with your doctor and let them know if you're taking other things as well. And definitely flag them if you've got any kidney issues because, as Emily mentioned, you need to be avoiding very specific types of antibiotics. And you're absolutely right, Em. Only use them if you need them because we get so many resistant bacteria because antibiotics are overprescribed and that causes other issues going forward. So, yeah, if they're needed, they're fantastic things to use, but there are also great herbal medicines and things that you can try as a stopgap before that. Anything else you want to add, Em?
No, I think we've covered most of it, all of it.
Perfect. All right. Well, hopefully you guys have found that useful of why antibiotics something just to be super cautious with if you've got chronic kidney disease, and then the conversation to have with your GP and making sure that you're not taking other medications and which antibiotics to avoid. So if you've liked this video, hit like, hit subscribe. That way you'll know anytime we put up new content. If you want to consult with Emily, reach out to our team and we can organise that for you. Head over to our website, www.kidneycoach.com, for all articles and things that we're posting on there. And every week we write a good content article that goes up that takes Emily and I eons to put together. So hopefully you're enjoying the content that we're putting out. If you've got any specific topics you want us to cover or talk about, make sure you put them in the comments below. I do check them and I will make sure we do a video on it. So thank you for being part of our beautiful community. Emily, thank you for your time and wisdom and sharing with everybody today. And we look forward to seeing you all in our Kidney Coach community next time. Be well, stay well, and we'll talk to you later. Thanks.
Bye.
Bye.